Welcome to the story of Healthy Pima, where we are connecting the dots to health equity in Pima County, Arizona. Our project for the NLAPH program was to connect health promotion to the social determinants of health in order to address inequity. We also wanted to empower individuals to be advocates for their own health and well-being. Now let's meet our Healthy Pima team. Jennifer Peters is the coordinator for community health promotion at the Mel and Enid Zuckerman College of Public Health at the University of Arizona, where she's also the project coordinator for the Arizona State Office of Rural Health Program Grant. At the college, she develops, coordinates, and delivers activities including information analysis and dissemination, planning, outreach, education, and training, support for community resource development, and strengthening partnerships and collaborations to promote interest in rural and border community health concerns. Next is Yamila El Kahat, Outreach Services Librarian at the University of Arizona Health Sciences Library, where her goal is to increase health literacy by better serving the needs of the underserved populations through improving access to Native American, Hispanic, border, evidence-based practice, cross-cultural, bilingual, and culturally appropriate consumer health-related information. Montserrat Caballero is the Arizona State Director at Enroll America, where she is responsible for statewide management of programs connecting uninsured consumers to health insurance coverage under the Affordable Care Act or Medicaid. She's also responsible for strategic and programmatic planning, fundraising and grant writing, media relations, partner and coalition building, and development. Finally, we have Anne Marie Medina, who acted as a team lead. Anne Marie is the Vice President of Corporate and Community Partnerships for the YMCA of Southern Arizona. Her job is to create strategic partnerships to advance the work and mission of the YMCA and to develop programs in partnership with other organizations to meet the needs of the community with a focus on health and well-being. Now let's look at our goal from our big picture. Our goal was to really engage in reflective thinking by doing things like probing and challenging assumptions, hypothesizing about outcomes, serving as a sounding board, and providing different perspectives. We consistently use reflection and what our coach Art refers to as the plus delta in our discussions with each other and the teams that we lead. These tools allow us to really explore where we are at, where we are going, and really ensure that we are moving in the right direction and with the right intentions. We wanted to really engage and encourage our partners in a long-term process, and we really needed to keep that motivation and commitment going. We're in the process of completing this goal because we've made the commitment to share everything that we have learned through NLAPH with our Healthy Pima participants during 2016. But we also wanted to hold those partners responsible for the plans and actions that they were developing and recognize the evolutionary nature of this work and respond to the pace of change inherent in community health improvement. This is really an area of growth for our team because learning how to hold people responsible is an ongoing process, especially when you have a large coalition of people who are at various levels of commitment. As we all know, the biggest challenge with community health improvement work is really getting those who are not working at the grassroots level to understand the slow and steady pace at which this type of work is accomplished. Again, we know that garnering support for projects that may take many, many years in order to implement is much more difficult than for those projects that show significant change in a very short period of time. Probably our most valuable lesson was learning the importance of reflection and how reflection plays into every aspect of the work that we do. We really wanted to be better planners instead of just jumping in and making quick decisions. And reflection allowed us to really make plans with intention that are much more realistic, and we find that we follow those plans much more consistently. It has also impacted us personally in that we are all much more reflective about our own personal lives, and we take care to plan for the future. We know that life is truly a reflection of what we allow ourselves to see and be. Reflection has made us better communicators. We find that if we have to reflect and then articulate, we have to really think about how to express what we truly mean and how to listen so that others really feel heard. Through our year of growth and learning, we found that communication among our team was probably our biggest challenge, whether we were using email or phone calls or apps. We really had to try multiple things from all the tools in our toolbox. But eventually, we finally just made a conscious decision to address the issue head on and committed to adding the plus delta to all of our conversations. This has resulted in a much better understanding of each of our needs in communicating with each other and has truly built a system of trust that we believe has created a much stronger team. You know, at the beginning of our journey, we had a pretty concrete work plan. But now, as we're getting toward the end, we find that we are just way more open-ended. The things we think about are more about partnerships, more about engaging people, and looking at the opportunities. But we feel that what we have now is just much more meaningful and has much better chance of having impact. Our original plan involved creating expanded curriculum for promotores, but now we want to use our leadership skills to engage the other co-chairs and the health department in the process to reconfigure the Healthy Pima Coalition to have greater impact on the county by incorporating the social determinants of health into all that they do. Our ultimate goal in addressing the social determinants of health is to work toward a model similar to Adopt Health in all policies. So here's our plan. We plan to bring together a focus group. We want to then report out regularly to our Healthy Pima leadership team and review all the compiled data collection tools we can find. We will then implement a pilot project with the public health nurses that work in our libraries and with one of our key partners, the El Rio Health Clinic, who serves a large population of underserved people. Probably the biggest outcome of our efforts this year was the realization that Healthy Pima needed to be restructured in order to be effective. Tools like the Big Picture and Got Data helped us to refine our focus and develop a stronger effort. NLAPH helped us to become a much stronger, more effective leaders by providing us with the tools and skills to build up our areas of strength and improve on our areas of opportunity. Moving forward, we plan to engage the Healthy Pima leadership in completing the universal screening tool and implement a pilot project with the community health nurses at El Rio. We're also really looking forward to sharing all that we have learned so that we can improve on the leadership skills of all the Healthy Pima members. So what will the Healthy Pima team take away from our year with NLAPH? Jennifer plans on managing up horizontally to transform the Center for Rural Health into a place of growth and opportunity. Montserrat wants to use her strengthened leadership skills to promote a transformative work environment, both individually and collaboratively. Yamila plans to use the tools and the skills she has developed to be more effective in accomplishing the outreach programs that she is responsible for in the state of Arizona. And finally, for Anne Marie, she wants to use everything she has learned to continue to grow as a leader and to help others to do the same. All in all, this year with NLAPH has truly been a year of growth and transformation for the Healthy Pima team.